Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to the Stem Cell Healing Institute podcast. We are here with Dr. Sara Figueredo. She is the research and general director of the institute. Hello, doctor. How are you?
Luis, thank you. I'm great. How are you? Thank you for having me.
You're very welcome. It's nice to have you back. We haven't done a podcast in quite some time, but we do want to catch up. Doctor, we do have an interesting topic today, which is endometrial stem cells for autoimmune disease.
That's right. That's right. It's been a few weeks, but I'm glad to be back. Yes, endometrial stem cells. We're the only clinic in the world, actually, that offers endometrial stem cells, which are adult stem cells taken from a healthy female's uterus. And we're the only clinic in the world that offers the treatment safely and effectively, and it works extremely well for autoimmune conditions. And various autoimmune conditions, including diabetes type 1, rheumatoid arthritis, multiple sclerosis, scleroderma. The list goes on and on for autoimmune conditions. So, yeah.
So
And
sorry to interrupt you. So for these endometrial stem cells, can you explain the process, how you get the actual stem cells?
Yes. So what we do is we get the stem cells from healthy, young, fresh menstrual blood, and we isolate the stem cells. These are, these are adult stem cells, not to be confused with embryonic or fetal or any younger cell line. These are adult mesenchymal stem cells, very safe, non-immunogenic, which means that they do not have any kind of immune response, no rejection. We can safely transplant them from a female to a male without any problems whatsoever, as if they were autologous or self stem cells.
So in this case, if a patient, because I need to ask you, let's say I'm a patient that's gonna have those stem cells transplant to me, can I bring my own donor?
Oh, absolutely. That's a very good question, Luis. Yes, if we once we do the screening for diseases, we want basically a very, very clean, healthy individual, female, of course, someone that doesn't smoke, not a heavy drinker, doesn't use any recreational drugs or even pharmaceutical for that matter. Someone that's pretty much has a healthy lifestyle, no endometriosis, no cancers. That would be a great donor. And we like them to be between the ages of 20 and 25 also for the healthiest menstrual blood. And it just contains an abundance of stem cells also.
So this process is done with a healthy female.
Yes, and what we do is we actually have donors, so we are prepared before treatment takes place. So we have the cells ready, incubating, and they're ready to deploy once we have a patient here and ready for treatment. And also we have them incubating in order to obviously not just to preserve them in a healthy environment, but also to grow the numbers so that we have hundreds of millions of stem cells for certain treatments.
So if I do want to book an appointment with you, how long will be like prior my visit? How long would it be a safe time for me to do the actual appointment?
Right now, we're booking out for about 3 months in advance. So we're not until we don't have availability until late September, October. We like to have a pre-treatment period of at least 1 month where we have all patients make some key dietary changes, sustainable ones, nothing that's too drastic or unsustainable, just enough to prepare their body, prepare their stem cells, because we will always combine their own autologous stem cells with the endometrial. Sometimes we only use autologous, but with autoimmune conditions, we will always use endometrial stem cells, which seem to respond and are very effective for autoimmune conditions where the body has antibodies that attack itself. And
And
so the
you will send all these pre-treatment to the patient, right?
Yes, so what I do is I get a history, and then we get the I send them the pre-treatment protocol, the guidelines, and they need to follow them before they come. And then once they do come, right now we're booking out about 3 months in advance, so they have at least 3 months to start preparing.
To get
And
healthier, to get a little healthier.
right. Yes, exactly, exactly. And then once they do arrive, we start them on the pre-treatment protocol, which includes nutritional IVs for detoxification, suppositories, 4 nights of a suppository, as well as B vitamin shots. And we also start them on oxygen therapy, as well as growth hormone therapy, age-appropriate growth hormone therapy, and a stem cell enhancement formula, which is a combination of key herbs and minerals for stem cell, the enhancement and the livelihood of the stem cells.
Okay, I understand there are different diseases for autoimmune diseases. How long would it take for the stem cells to do their job? When would I still
Yes,
feel better? That depends of my condition, of course.
yes, that's right. So it depends on the condition, but we literally see patients feeling better within days to weeks. And to see the full results, it takes about 3 months, at least 3 months to see the full results. And then it just continues from there. Because regeneration takes time, with disease, any disease, when there has been damage done to a tissue or an organ, basically the stem cells go in and reconstruct that damage. So it's literally not going to be overnight. So it will take time to rebuild with all of the nutrients in the body, proteins, amino acids. The stem cells take all of that and reconstruct the damaged tissue. And so yeah, so that takes some time, but we do see patients that start to see changes within weeks.
How do you actually deploy these stem cells into the patient that suffers different, was in this case autoimmune disease? So I suppose for a diabetic will be different than for arthritis or any other condition.
Right. Yes. Okay. So absolutely. So with autoimmune conditions, because the condition it involves antibodies, which is part of our lymph system, part of our part of our immune system, and that begins in the lymph system and the lymph nodes. So and these antibodies are attacking our own cells. Okay, so that's what happens in autoimmune. Auto means self. So in this case, what we do is we apply the stem cells into the lymph nodes, okay, into the lymph system directly, as well as IV. So we're getting it both, both modes of administration, which makes it so effective. And then when we have arthritis and other, more localized degeneration, like in arthritis of the knees and of the hands or the shoulders or the hips, that's when we go in locally. We go into that local joint because the joints are so devascular. They're not very vascular. There's not much of a blood supply in the joints. So in that case, we have to apply the stem cells locally. But with the rest of the autoimmunity and with other conditions where we want to get to different parts of the body, we will apply it IV right into the blood, as well as right into the lymph nodes of the lymph system. That was a
Yeah,
very good question, Luis.
because you explained once or a few times before that the stem cells are like a smart cells that go to the where the problem is and actually regenerate the tissue and That's how they
Yep.
work, right?
That's right. That's right. So when there's damage to a specific tissue, that specific cell, when it's damaged, it breaks open and releases inflammatory cytokines, that they're called, like inflammatory markers. They're called cytokines. And these cytokines are like chemical messengers that signal to the stem cells that, hey guys, the damage is here. It's for this cell, for this specific cell. And then that's how the stem cells know where to go, especially when the stem cells are in the blood. So they know where to go because they can sense the inflammatory markers that are specific for a specific cell and tissue.
Well, that was very well explained, doctor. I think any normal person like us will understand that. And we really appreciate that you take the time to explain how the process is done because I'm sure a lot of people are wondering what to do. In this case, how can they reach you, doctor?
Oh, good question again, Louise. So they can reach us at on our website, www.stemcellhealinginstitute.com or stemxcure.com. They can also reach us on Facebook and Instagram, as well as listen to our podcasts on Spotify, Anchor, and we have our YouTube channel. Did I miss anything? Oh, and they can reach us by email also, info@stemcellhealinginstitute.com. They can reach us by phone also. The US number is 209-690-7836. And our local Guatemalan number +502-4220-7297. That they can also reach us on WhatsApp with that number.
Exactly. I was just going to say that. Well,
Thank you.
doctor, is there anything else you would like to add to this podcast?
I think we've covered a lot of ground today, Luis. Thank you so much.
So, if you want to see a version of this podcast on video, you can find us by looking at Doctor. That will be Dr. Dot Sarah. That will be Zahra Figueredo. That's how you find the channel. So it was nice having you guys here, and we will be posting more podcasts on this channel. Thank you.
Great,
You,
Luis.
doctor.
Thank you. Have a good weekend.
You too. Bye bye.
Thank you.